introduction. Look, Brynhangdar, good afternoon. Real pleasure to see everybody here. And yes, I was a bit of a talking head last year. It was no reflection on, I know, I hope me being warmly received last year at that time, but I think it was probably either my first or second week in my role as Director General at NHS Wales, Chief Executive, and I was suddenly discovering that my diary wasn't quite as in control as perhaps it had been in my previous roles. In fact, I think on that day I was with ministers, which seems to have become my catchphrase over the last 12 months or so. I was actually in this room 2 weeks ago with the whole of NHS Wales. Well, I say the whole, it wasn't all 72,000 staff, of course, that would have broken the health and safety rules in here. But all of the respective boards and organisations just sat in here at a chance at one of our Team Wales events where we get together and reflect on priorities. And as I looked around the room, I could see many familiar and friendly faces. And what's nice for me actually this afternoon is, as I look around the room, is actually being able to look through a social care lens, and I hope with some of the contacts that I've had over the years, and actually see some familiar and I hope friendly faces around the room as well. And the Director General role that I've got in Welsh Government, people often forget perhaps, but it's a role that does encompass both health and social care in Wales. I'm very ably supported by Albert Heaney specifically, but also Albert's team in discharging those functions and responsibilities with Minister. But the NHS Wales perspective, I guess, can dominate a lot of the reflections and some of the expectations about my own role. But I think I want to repeat what I said on camera last year, not because I necessarily remembered saying it at the time, but it was quite important to me, which is I do take the responsibility to be overseeing the social care aspect as a very significant responsibility, and to make sure that I am discharging my accountability for that and in support of you. And I would just want to say that I hope the reason that I'm familiar to some of you in the room is because I've tried to be part of the social care process actually over many years. I could have been simply obsessed about the way in which hospitals were organised because my background was actually working as a hospital manager. But in fact, particularly when I became a Chief Executive 10 years ago, working in the old local health boards, you could just see that the world and environment was something very different. It wasn't simply about responsibilities to receive people through the front doors of A&E. It was rather the emphasis on supporting people in need, often at their most vulnerable, and to try to put the right packages of care and support. And in some respects, recognising that it's probably necessarily not just what the NHS or social care separately do, it's that people receive the right care and treatment for their needs at the time that they require it. So I've spent a lot of time with colleagues locally in my respective roles over the years, but I've also tried over this last 12 months to spend time with colleagues generally. So I have had the opportunity to meet with directors of social services in different arenas, all as a group, and actually in smaller groups as well. I've actually been able to do some visits out to some facilities. I was just bumping into colleagues from Powys earlier who'd got me to look around one of their integrated facilities as well. And I do want to make sure that I can push these things on, the things that you think need to improve, but I also have a role, of course, to bring the NHS to the table and to make sure that when we reflect on things like integration, responsibilities around citizens, that we make sure the health service can bring its own contributions as well. And how important is it to make sure that we can focus on those who are the most vulnerable, children with needs, older people, really making sure that we can respond to them in a professional public service approach. The theme for your event over the next 2 days is about working together, delivering together, and in some respects it's kind of wrapped up in my own role. It's not about me having to just simply talk to a series of different organisations. You know, I have to myself inwardly reflect on the health and social care dynamics. I have to reflect on the way in which Welsh Government works with the NHS. So I'm probably the epitome of working together for Wales, all wrapped up in kind of one title, if that helps. I thought that I would just reflect on a few areas that may just help stimulate, and I hope they'll blend with some of the discussions that you'll have over the next 24 hours or so. But if I perhaps focused on just these few issues, it might just stimulate some discussion, not least around your workshops and as you network as well. So I thought I would just reflect on some principles around prudent healthcare, and although that's been the label that we've used over this last 18 months or so, I mean, I think the reality is this is about prudent care, and that was definitely a strong feeling I had when I met with directors of social services, is that the danger is we just create another silo if we're not careful in terms of some of the interpretation, and I reflect on that. To give some reflection on integration and things that I know are happening across all of Wales, the importance of whatever the national lens that we look through, making sure that we can really focus on the development of local services. Some developments going on around the workforce field within the Welsh Government Department that, although has a very strong NHS focus, I think is about blending in opportunities around joint working with social care more broadly. And just to finish off with some reflections on working together. So I hope that will help move us through the next 20-25 minutes or so. I hope most of you in the room would have heard, at least in passing, about prudent healthcare as an approach, something that certainly the Minister's focused on an awful lot over the last 18 months or so. He originally introduced the concept in a conference speech that he made to the NHS Confederation back in January 2014. And as much as our responsibility as officials has been to try to give some clarity about this, to take a very strong concept and hopefully give some examples of how this is starting to work across different areas of Wales, it would also to reflect that it was something very personal for the Minister with his own background and his own perspectives on how, even in the toughest of environments that we have, there is a need to work through and do better with the resources that we have. And we've gone through various iterations about trying to define what prudent healthcare is about in different ways, and the Bevan Commission has gathered recently to just look at the evidence that has been gathered over the last 12 months and really now made its pitch that there are 4 different dynamics to prudent healthcare. And I think what I'll just do as a matter of principle for today is, shall I just talk about prudent care and just drop the health bit, not least for this audience? That might just help stimulate us in a different way. But the principles around this are, firstly, to start, this may sound as though this should happen anyway, but that we establish that patients are participants in the process. They operate alongside us, whether they are clients receiving services or patients, in terms of their own expectations. But the traditional, certainly NHS system, can often feel that it is doing unto people, rather than actually really genuinely trying to listen. And I think one of the reflections that I would have for all of our services in Wales, that you take the NHS as one example, the millions of contacts that we have with patients every year for a 3 million population, 1 million A&E attendances, 4 million outpatients, 18 million people seen in primary and community care services, 800,000 people seen in optometrists across Wales. We're a high volume service to meet the needs of the population, but we have to find mechanisms that, despite those volumes, to create the individual contact and experience that people quite rightly want and deserve. So there are very high public expectations. And in some respects, our professionals, I guess, have been on the pedestal in respect of the drive around health services, not least from the inception of the NHS back in 1948. But the world has changed. The sponsor's contribution about the way in which technology changes. Very often now, you'll have people wandering in to a consultation session, whether it's with their GP or with a consultant, for example, and they've probably done almost a PhD in research on their individual condition, as they see it, in order to be challenging professionals around some of those expectations. But we're very clear that we have to start the discussions with those who are receiving that care and attention and trying to create that different relationship. And that can be quite challenging in a high-paced, high-volume environment, and it can be quite challenging to professionals to feel that we can facilitate that. We need to have a system that somehow can focus its attention on those who have the greatest health need. The care needs drive our mechanisms and processes, and if we look genuinely across Wales in terms of some of the systems that we have in place across organisation, there's an awful lot of variation still in place, although we would expect an NHS system, for example, to try to work its way through these. There is inconsistency, and we do need to attract for that. There's something about doing only what is needed, and particularly to make sure that we do no harm. Now, you may think, well, how on earth can you stand there and justify that the NHS should do no harm? But even in our current system, and this is a reflection on the whole of the NHS across the UK, we often focus on shiny new guidance coming into our system. The National Institute for Clinical Excellence produces the latest standards and expectations for technology, services and drugs that people should want and expect. But the kind of unknown side of our system is often that as the new technology and advances are coming in, we tend to not really focus on what's left behind. So even today, across the whole of the NHS, there are examples of around 900 evidence-based interventions that should not be taking place any longer because NICE has said so, but because they're lost in our traditional system, are still actually part of clinical and professional practice. So we're very good at adding to the system. What we're not very good is actually about taking away the things that genuinely don't work. And the worry about do only what is needed is a worry that perhaps what we're trying to do is to not genuinely focus on people's needs. I think the original phrasing was to do the minimum intervention. Now, that doesn't really sound like a service that's generally trying to wrap around an individual's needs. But I think what this is really trying to emphasise is that sometimes, and certainly this is the NHS experience, we end up throwing more than just the kitchen sink at individuals when they're coming in with a very specific need and condition. And the danger of going into an A&E department and suddenly, if you're an older person, you've got a range of multiple conditions, but you're managing many of them okay by yourself, to have the whole system of testing and results throwing themselves at you, and the real danger of over-medicalising, actually, the approach that we take to care and treatment in the current environment. So there's a bit of a challenge about what we need to do. And the final challenge is about reducing inappropriate variation and really trying to stand back and with a system that we define as being about Wales, a countrywide approach, whether it's care or it's on the NHS side, still recognising that there is still very significant variation about our processes, our systems in place and our outcomes. And that even happens across the 10 health organisations that we have in Wales. I was looking at some data and information needs of communities. And there are different and variable needs across Wales. We know that from our population statistics, the way in which we look at health. We do have to have different attention to different parts of the Welsh population. But I think in the best scenarios, and certainly those clusters that I would say seem to be maturing fastest, it's not a discussion simply about what a GP is going to do with some extra money. It's about what a cluster is going to do about local public services and really to bring together a very holistic approach, including all partners and housing and third sector. And this is reflected in our primary care delivery plan for Wales. This, I think, is one of the most important plans that we developed and announced in Wales for many years. We've always had an aspiration to try to push some of our care and services away from this over-reliance on hospitals. I know we're fascinated by bricks and buildings to some extent in terms of accessing services. But this is really trying to make sure that rather than just talk about our expectations, trying to now make sure with some proper funding going in, that we can genuinely get this primary, social and community-based environment and also have excellent hospitals available for when care and specialist treatment is required. So I think it does set a significant expectation, sets the bar quite high for our next set of expectations for services. And it's going to require a very skilled local workforce. But importantly, for this to work effectively, it's going to require strong leadership, and not least from many of you in the room here today, to see this as an advantage to be pushing on. And I was really pleased, certainly in my time as a health board chief executive, to know that this was chiming actually with the thinking behind the way in which local authorities were wanting to focus some of their local services as well. So there are 64 planning areas that we've established in Wales through health boards in their own negotiation with local authorities and with other partners and stakeholders. We're looking for shared priorities based on the needs of that very specific population, to use the partnership arrangements, and simply to be able to make more effective use of the available resources. And it includes the Minister having made an announcement that every cluster in Wales is actually going to receive a very specific fund of money, £100,000 per cluster in Wales, simply to enable them to focus on the local needs that they have, in addition to the millions of investment that has been announced as well. And just to draw together some of that, I do think there's a genuine chance and opportunity for us to try to do something about the way in which our collective workforce fits here together. And I think the workforce, as I would define it here, isn't just simply about 72,000 members of staff working on the NHS, or add on a few thousand for people working as GPs or as dentists in Wales, and adding on even more thousands who are working in the social care side, whether it's in domiciliary care settings, but brings in also the care home sector and the way in which workforce needs to work there. And I think you're all probably pretty aware of this in Wales, but we get very fascinated by the number of hospital beds in Wales, but actually the number of nursing beds in care homes in Wales is actually pretty much the same number. It's around 12,000 for nursing beds. When you add on residential beds on top of that, this is probably around 2/3 of the available support capacity for clients and patients in Wales, actually represented through the independent sector, whether that's through provision or whether it's the commissioning responsibilities of health and social care. And there have to be chances for us to, yes, recognising everybody has their own organisational responsibilities, just looking at the workforce in a very different way there, and certainly to make sure we don't develop a 10-year plan for the workforce in Wales that is simply only about the NHS or those working in hospitals, but is including those working in our primary care system and can help draw in some of the recruitment issues and developments and training that are required for the care home sector, and start to bring together some of the roles that are possible around workforce, particularly in the way in which health and social care can both support and substitute. And I think we've got some common principles and values to go at. I think often we can spend much time thinking about all of our differences, but we're all here to support our population to receive the care and treatment that they deserve at their time of greatest need. That's a very strong common purpose, I think, to bring any of us together. So we're doing various things in Welsh Government to facilitate this. Areas like our health professionals education review has been to try to turn some of our traditional approaches around how we spend £350 million a year around professional support and training into something that could feel a bit different, and there'll be some further chances for reflection on that through the summer months. Wanting to see more new skills and roles emerge with examples already in place across Wales, and actually asking the question of all of you is, what is it that's helping you to drive integration when we come down to frontline services and the kind of support that's available? So the most important thing out of that for me is, given all of the requisite experience gathered in this room, is to make sure that we use your skills and experience to understand what choices we have next to make in order to provide that kind of environment. So just to finish off, for reasons I don't really need to explore or go into, but my brother works in the travel industry, and I happen to have a fantastic opportunity, not to be missed, where I was able to join him in Africa 2 years ago. And I've always been someone, I think, who's adopted a partnership approach and collaborated over the years. I hope I can look into most people's eyes and say, I think I've always done that over time. It's not just a recent revelation to me. But I was sat in Johannesburg Airport, and I've shared this with health colleagues, where I just saw this on the wall of Johannesburg Airport and took a picture of it with my iPhone, as we do all of these days. And I just thought this captured the spirit of the approach that we could establish actually for Wales and across our services. If you want to go fast, go alone. If you want to go far, go together. And I just thought, you know what, that is probably about a Welsh approach, irrespective of the fact I know that's got its origins in Africa as well. So I share that with you in the spirit intended, because certainly that's my commitment to all of you, is to help enable, lead and facilitate some of those changes. So just to finish off, I guess being physically here with you this year, rather than just a virtual talking head, I had the chance to say thank you, actually, to all of you for the respective roles that you do in the different environments for care settings, social care, your leadership responsibilities, your head of service requirements, and just to acknowledge that level of support which is so essential to keep the care system going in Wales. So thank you very much for what you do on a day-to-day basis. Diolch yn fawr, thank you for listening.